Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Anthrax is a serious illness. It is caused by bacteria called Bacillus anthracis. These bacteria release harmful substances called toxins. These toxins make people very sick. Anthrax is found naturally in soil. It usually affects animals like sheep, cows, and goats. Humans can get infected through contact with infected animals or animal products. Anthrax is not contagious. This means it doesn't spread from person to person like the flu. Anthrax spores can survive for a long time in the environment. This makes them a potential threat if they are released intentionally. It is important to remember that anthrax is treatable with antibiotics. Early detection and treatment are crucial for a positive outcome. Anthrax infections are rare, but they can be very serious. That's why it's important to know about this disease. Understanding the causes, symptoms, and prevention methods can help us stay safe and healthy. Anthrax infection can occur in different ways. The most common types are cutaneous anthrax. This type affects the skin. It happens when anthrax spores enter through a cut or sore. It causes a raised, itchy bump that turns into a painless ulcer with a black center. Inhalation anthrax. This type affects the lungs. It occurs when anthrax spores are breathed in. It can cause flu-like symptoms like fever, cough, and chest pain. Inhalation anthrax is the most serious type. Gastrointestinal anthrax. This type affects the stomach and intestines. It happens after eating contaminated meat. It causes nausea, vomiting, diarrhea, and abdominal pain. Injectional anthrax. This type is newer. It affects those who inject drugs. It causes severe skin infection and can spread throughout the body. Each type of anthrax infection has its own set of symptoms. It's important to be aware of these differences to ensure timely medical attention. Anthrax is caused by the bacterium Bacillus anthracis. These bacteria form spores. Spores are like tiny protected capsules. These spores can survive in harsh conditions for many years. They are found naturally in soil and commonly affect grazing animals. Humans can get anthrax in a few ways. Contact with infected animals. Touching or handling infected animals or their products like wool or hides can transmit the spores to humans. Inhalation of spores. Breathing in airborne spores, especially in areas where anthrax is common or in cases of intentional release, can lead to infection. Consumption of contaminated meat. Eating undercooked meat from infected animals can introduce anthrax spores into the body. Injection drug use. Sharing needles or injecting drugs contaminated with anthrax spores can transmit the infection. It's important to remember that anthrax does not spread from person to person. Section 4. Recognizing the signs, symptoms of anthrax. Anthrax symptoms vary depending on the infection type. Here's a closer look. Cutaneous anthrax. Small, itchy bump resembling an insect bite. Develops into a painless ulcer with a black center. Swollen lymph nodes near the sore. Inhalation anthrax. Flu-like symptoms such as fever, chills, and cough. Chest discomfort or shortness of breath. Extreme fatigue and muscle aches. Gastrointestinal anthrax. Nausea, vomiting, and loss of appetite. Severe abdominal pain and bloody diarrhea. Asterisk, fever and dehydration. Injectional anthrax. Severe soft tissue infections. Skin sores and abscesses at the injection site. Systemic illness with fever and chills. If you experience any of these symptoms and suspect anthrax exposure, seek immediate medical attention. Section 5. Diagnosis and treatment of anthrax. Diagnosing anthrax involves a combination of medical history, physical examination, and laboratory tests. Doctors will consider potential exposure to anthrax spores and evaluate the symptoms. Lab tests help confirm the diagnosis. Blood culture detects the presence of Bacillus anthracis bacteria in the blood. Skin lesion swab examines samples from the skin sore for anthrax spores. Chest X-ray checks for signs of infection in the lungs. Anthrax is treated with antibiotics. The type of antibiotic and length of treatment depend on the infection type and severity. Early diagnosis and treatment are crucial for successful recovery. Section 6. Prevention and protection. Staying safe from anthrax. Prevention is key in protecting yourself from anthrax. Here are some essential measures. Vaccination. A vaccine is available for people at high risk of exposure, such as military personnel and lab workers. Safe handling of animals. Wear protective gear when handling animals or animal products in areas where anthrax is common. Thorough cooking of meat. Ensure meat is cooked thoroughly to kill any potential anthrax spores. Avoid contact with suspicious materials. Do not handle any powders or substances that could be contaminated with anthrax. Report suspicious activity. If you encounter anything suspicious that might contain anthrax, report it to authorities immediately. By following these preventive measures, you can significantly reduce the risk of anthrax infection. Remember, knowledge is power when it comes to staying safe from anthrax. By understanding the risks, recognizing the symptoms, and taking preventive measures, we can protect ourselves and our communities. UMCC, your ultimate medical consultant connectors.